is this base desire to go, I want to understand death. I want to understand death to my best ability and how I understand it. If I can come to terms with it, come to peace with it, and psychedelic medicines can help that, everyone should have that option. It frees them to understand that, life is precious and I am going to focus on what's important. This is where psychedelics, I think, can really help come to an understanding of yourself, and you come to an understanding of what your meaning or purpose might be.
The container is now open. On this episode, Christine Caldwell talks to us about using psychedelics with those facing death. Through her nonprofit End-of-Life Psychedelic Care, or EOLPC, she popularizes and destigmatizes this breakthrough approach to death work. She talks to us about their at-home ketamine pilot program, why these medicines are so potent in this stage of care, and of course, so much more. Her insights take us deep into what it means to be alive and what it means to die. But before we get into this really moving conversation, I would just like to shout out our patrons. They went to patreon.com/thecontainer and they offered to make small monthly donations. If you get a lot out of the container, this is the single best way to make sure that there's another container episode next week. While thousands of people enjoy us on the RSS feed and the YouTube page, very few people actually choose to support us. So to those who do make that choice, really deep gratitude. Other ways you can help us out is by liking, subscribing, and leaving comments on our YouTube. That's really important for the algorithm. If you listen to this on Apple Podcasts or Spotify, leave a rating and review. Those are simple, very quick ways that you can make a big difference for the container. And so to the people about to do that, again, massive thanks to you. We're really grateful. And now, our discussion with Christine Caldwell on psychedelics and end-of-life care. I would really like to hear your thoughts on the end-of-life process, and then really learn why, for you, Christine Caldwell, psychedelic care can be so powerful.
Well, that's a great question. That'll take the whole hour to talk.
There we go. All right, my work is done.
I think I'd like to mention two things up front, and that is, yes, I named my nonprofit End-of-Life Psychedelic Care, and yes, we talk very frequently about the use of psychedelics and their benefits for people who are really close to the end of life. But we really are talking about anyone who is faced with their mortality because of a life-threatening or serious illness, and they begin to experience death anxiety and fear of dying and fear of the unknown. So just to set that context, and I always like to say, psychedelics are amazing. We all know this, and I've got so many stories that attest to that. But psychedelics are not for everyone, and some other modalities like meditation, like faith, can get you to the same place, without psychedelics. So perhaps I'll start then, having said that. When we think of people who've been diagnosed with a serious or life-threatening illness, and their life changes in an instant, and so all the things that you thought you knew kind of go out the window. And I look at that across several dimensions. So let's start with physiological. There is a disease process going on in your body that you have to deal with. There are medications with probable side effects. There is pain that also has to be managed. So, from a physical standpoint, it's already tough. And then if we look at a psychological impact, where yes, I've known many people with a terminal diagnosis who are severely depressed, or their anxiety spikes through the roof, becomes debilitating, actually. And you look at some of the other things that might happen, like there's shame, there's guilt, they can't forgive themselves for something they might have done, or they can't forgive somebody else for something they did. And then we could look at existential. You've lost your purpose in life. Let's say you were the patriarch or the matriarch, and it's like, well, your family knows you're out of there, so you're losing that status you held, and you're really worried, oh, can my family take care of themselves? But you're letting go of everything you've ever held near and dear. So not just your family members or your loved ones, your friends, your pets, your home, favorite things, whatever. You're letting go of everything, and that's very hard for us as humans, which goes along with fear of the unknown. And then we could look at spiritual concerns. So, what does your faith tell you where you're going? And do you think you're going to hell? So now I'm dealing with that. A lot of people derive comfort from their faith, but it can create angst, in other folks. And then I would say, last but not least, not that this is a complete listing, are social and cultural. So your family. Sometimes families are totally supportive. Sometimes families are like this, right? And so if you're already in this disease process and you're already feeling like you're a burden on your family, and you're at odds with your family, or they start making the decisions for you when, and taking away your agency, lots of issues there. And then, are you in a community that is supportive, or are you isolated? So, and we know isolation hastens depression, which hastens death. So all of those factors, which is a lot going on in this individual's mind and being as they're faced with their mortality. So pretty heavy duty. I
Yeah,
think
just as you're listing that, I'm having death salience anxiety coming up.
Exactly. We sometimes make people go through a death meditation, which basically takes you through, and Sai, I don't know if you're familiar with this, but basically takes you through letting go of everything. And it freaks some people out. It can be tough. Now, if you're a Buddhist, you're practicing impermanence. You're a student of impermanence. But for most of us mortals, that is a really tough thing to do. Yeah. So, all right, why
Yeah.
psychedelics? I mean, for a lot of people, psychedelics can help with every single one of those things that I just talked about. And arguably, we should start with psychedelics way before we're faced with any sort of serious or life threatening illness, or we're even contemplating death, a very young adult, for example, and begin to come to terms with your own death and dying, which we believe in turn helps you live a more full and purposeful and meaningful life. So I also wanted to say that again, we're talking about people with terminal illnesses, generally speaking, but this medicine can really help a lot of people farther upstream. So, and the psychedelics aren't created equal; they're different molecules, right? So, can I talk about each of them and how they're a little bit different and how they can help these dimensions that I was just talking about?
Yes, please. That sounds fascinating.
So
Yeah.
we'll start with psilocybin because that's one of the most popular, and that's certainly how I entered into this field. The research that was done in what I call the modern era of psychedelic research out of UCLA and Johns Hopkins and NYU all pointed to the fact that psilocybin in advanced cancer patients really could decrease depression and anxiety and improve quality of life decrease
And just
demoralization, which is, a form of existential distress.
I
So,
wanted to say for the audience too, psilocybin, that's the active compound in mushrooms, psychedelic mushrooms, correct?
right, yes, in magic mushrooms. So that was where a lot of the, like I said, modern era of research in this field went to. Although in the 50s and 60s, with people like Walter Pankey, they were looking at LSD and finding very similar results. But many people dismissed those, or many scientists dismissed those because they weren't true random, blind studies. But in any case, psilocybin really became a go-to in the 2010s and into 2020s, and the that field in terms of psilocybin has exploded. So if you think what psilocybin can do, and this is a generalization, so everybody has their own experience, and what I'm going to share, you go, no, I feel that way on ketamine, which is okay, great. But generally speaking, psilocybin is a very somatic medicine. So you feel in your body. We hear many stories about cancer patients, whether that's in clinical trials or in real world applications, who confront their cancer, have a chat with their cancer. They're able to come to terms with their cancer. I'll probably share a few stories about Thomas Hartle, who was the first Canadian to be approved for psilocybin therapy through Health Canada. And he speaks to this, very eloquently, where he ended up calling his cancer almost me. His cancer on one journey said, "Do you think I want to be here? I don't want to be here." And he understood it's all consciousness. And he said, he has since passed, do you think I would be the person I am today if it wasn't for my cancer? So it was just a beautiful acceptance. And this is what I hear over and over again of people being able to somatically feel that they are one with their cancer. And it is a feeling, right? Because a lot of us, we're in our heads so much, and intellectually we may understand that. But until you really feel it into your body, I don't think it happens for most of us. So you have that. Compared to the other two I'm going to talk about right now, ketamine and MDMA, it also brings about, I think, greater unity consciousness. So really important. And we'll probably talk a little bit more about spirituality later, but that ineffability, that inability to describe, in words, the experience that you just had. And again, this feeling of being one with the universe or being one with ourselves internally. So very generally speaking, that's psilocybin. And the good news about psilocybin is it's slowly but surely becoming legalized. And so in the states of Oregon and Colorado, you can experience psilocybin. In the state of New Mexico, they are coming online toward the end of this year, 2026. And the models are different. One's a medical model, and the others are non medical models. But nonetheless, there is access now to psilocybin, which we didn't have legally before. And in many jurisdictions, psilocybin has been decriminalized, which has different meanings in different jurisdictions, but primarily it means the law enforcement is going to leave you alone. So, we're living in a good time to see this shift. So let's talk about ketamine a little bit. Ketamine is called a dissociative anesthetic. It was approved by the FDA in 1970 as an anesthetic and an analgesic. So it could manage pain as well. The dissociative part is what's interesting, because now you get this feeling of your body separate from your mind or your head, and you're kind of floating out there. And people will say, yeah, this dissociative effects makes me feel like I am separate from my body and I don't need my body. It puts you into an observer mode, which allows you sometimes to have a much more objective view of the issues that you're facing that I had talked about. So it's a beautiful medicine from that standpoint. And the other thing I absolutely love about ketamine is that it's been used since the 1990s to treat chronic pain. And in palliative care, this is so critical. So you think about somebody who maybe is suffering from neuropathy, or there is this chronic regional pain syndrome, which is extraordinarily painful. Trigeminal neuralgia, extraordinarily painful. And so ketamine can really reduce the pain. And we know if you reduce chronic pain, you can reduce depression. Reduce depression, you can reduce chronic pain. So ketamine is now, working hand in hand to help both of those. And that gets at when I talked about physiological issues. So the other thing that we love about ketamine is when they did a retrospective study, and there was some 15,000 reports of psychoactive substance experiences and 600 or so reports of near-death experiences. Ketamine was most like a near-death experience, which
Mm.
there's been studies there too. Johns Hopkins did a really well-known study of, again, retrospectively asking people and comparing their experiences along the lines of transcendence and ineffability and decreasing depression and losing your fear of dying. And the psychedelics in general mimicked near death experiences. And so I would say for any of us, basically psychedelic journeys are probably more fun than a near death experience. So I pick those over the other ones. But ketamine can really help from that standpoint. And there was a lovely story of a woman with end stage cancer had metastasized, and she was a psychonaut, so she had used a lot of different medicines. But toward the end of her life, she was participating in 2 ketamine sessions a week. And her intention literally became, I'm going to go on the other side and chit chat, however she said that. And she would. So she would go chit chat with her loved ones who had passed, and then she'd come back. So I don't know. It's also a phenomenal medicine, and it's legal everywhere. And so, right now there's people that are providing ketamine in a clinic situation, in a hospital situation, sometimes for the pain, and in the home. So a lot of different locations that make it more easily accessible for individuals. There's telemedicine, which I think under supervision can be really good, where you get a form of ketamine delivered to the home. They're called sublingual lozenges, basically. So a lot of ways that an individual can take ketamine, a lot of different forms, I should say, because there's intravenous, there's intramuscular injection, there's these sublingual lozenges. And for palliative and end of life care, there's also rectal administrations and topical administrations. So lots of
And
different
there's also
variations.
nasal. I think there's nasal as well.
Thank you, Sai. Yes,
Yeah, that
yes.
comes along with the sublingual. There's if I can just I want to that's something that really struck me about how you're describing the two-pronged approach of like both reducing pain but also the dissociative observer effect. I think what really stands out there for me is that what I notice, at least especially with people I work with, is that the pain is not only is it excruciatingly painful, but it prevents this self-reflection, because every time they'll attempt to self-reflect, they just come back to that pain again. And
Mm.
it's and I've experienced chronic pain with a pinched nerve before, and I just remember it was like no matter what I did, that was where my consciousness would come back to, is like
Mm,
that. It was just so loud and alive that it, no matter, like all the things that I tried, I just couldn't come to a peaceful state where I was able to be in like a metacognitive awareness. And so I'm just noticing that having both of those in the same medicine is probably really helpful.
Mm.
Yeah,
Yeah.
thank you for sharing. That is a beautiful story because ketamine and psilocybin, for that matter, I loved how you said, yes, it can reduce the activity we say in this default mode network, which is that the network of the brain with several different regions, the prefrontal cortex being one of them, where people with higher anxiety and higher depression, that default mode network or DMN is more active. And if you can quiet that down, we can quiet those negative, looping, intrusive thoughts. That's what I experienced, through my ketamine therapy. And it allows you then to, yeah, meditate and have affirmations and really begin to understand and embody them as well. It's not like we don't embody some of these beliefs with ketamine, despite what I said about psilocybin. So, yeah, I love that story.
Yeah.
So, I will also mention MDMA. So MDMA has been studied for years, as you know, for PTSD, for trauma, and it's extraordinarily efficacious and beneficial for individuals with PTSD or any form of trauma, domestic abuse, for example, because it's different than what I just said about ketamine and psilocybin. It increases the activity in the default mode network. So you're not quieting it down, but what you are quieting down is a region of the brain called the amygdala, and that's your emotional center, that's your
Mm.
fear center. So if you can decrease the fear and sort of increase this ability to process the trauma with a trained therapist, the studies had shown that fully two-thirds of the participants after their standard protocol, which is generally 3 MDMA sessions and psychotherapy, were in remission. That's unheard of, with the standard protocols that have been used. So, but before MDMA, like psilocybin, LSD, was labeled a controlled substance, it was used in couples therapy. And this happened. So prior to 1985, MDMA was used in couples therapy. Well, that's because we consider MDMA an empathogen, a heart opener. So again, you think about somebody who is now faced, as I was mentioning, shame for things that they might have done, not wanting to forgive somebody else, you know, being in angst over, oh my gosh, did I do everything I wanted to do in my life? What's my legacy? All right, this is where MDMA is like incredible. So people have used it then to enable self-compassion, to forgive themselves or to forgive someone they felt that wronged them. So a beautiful, beautiful medicine that we hope will be approved by the FDA sometime soon. So those are the three medicines I generally speak about. There's others, there's other forms. There's a psilocybin called analog, so a form of psilocybin that is a shorter duration and reduces the nausea that sometimes can be experienced with psilocybin. And so there's a large scale study taking place. And if your viewers want any more information, they obviously can reach out to me. But a large scale study taking place in at least 20 different locations around the country. And they're looking for participants with cancer, with multiple sclerosis, with ALS, with Parkinson's, and idiopathic pulmonary fibrosis. So again, now expanding sort of the disease conditions beyond just cancer, which I think is phenomenal because now we're looking at not just helping people reduce depression, anxiety, say for Parkinson's patients, but also improving their motor skills and their cognitive skills.
I just want to point out, because this is like a synchronicity, that the very last episode we posted on the container was with Stephen Jenkinson talking about his Parkinson's diagnosis in very beautiful and extensive detail. And so I'm just noticing there's like this correlation that's popped up a few times in the conversation. Yeah.
Yeah. And so, again, for any of your viewers who are interested, UCSF in San Francisco is recruiting for a trial for Parkinson's patients. So I would encourage anybody that's interested. And, you don't have to live in San Francisco. You have to come in for the psilocybin sessions. But otherwise, everything is done online.
You yourself are involved like directly in research of these chemicals, and particularly in ketamine right now, I believe. Um, yeah, I'm curious about what kind of research you're up to and what questions you're asking.
Yeah, I'll clarify that. As a nonprofit that's primarily an educational organization, we're not funded to do large scale research. But what I was able to do in collaboration with the University of Chicago researcher was a psychedelic death worker study. And it was a mixed use survey for phase one with 100 responses. And we learned a lot about the individuals doing the work and their observations of the clients that they served. And I'll come back to that in a minute. And then the second project that we're involved with right now is not research. It's actually a community-based pilot. So this is getting
Mm.
ketamine, in this case, into the hands of the community. No, I mean, there's obviously eligibility criteria and a medical screening, but it doesn't carry the same sort of exclusions that a normal clinical trial does. And this is a home-based ketamine and spiritual care pilot in 3 different locations around the country. So Northern California, Chicago, and Atlanta. And what I love about it is that we are pairing a palliative medicine physician with a spiritual care counselor. And that could be a chaplain or an end-of-life doula or a minister. And it really depends on, the sort of demographic where we're hosting this. So we really want to prove out the value of spiritual care in this manner. But it's interesting. It morphed a little bit for me because we called it home-based ketamine and spiritual care, when in fact it is, I should say, a spiritual model. So we're not saying we call them the spiritual care team members, you are responsible for spiritual care. It's the team is bringing in mindfulness, is bringing in a sort of sensibility of asking questions, not to say, not necessarily say, what are your spiritual beliefs, but understanding what a person is going through. And I think maybe it would be helpful if I define spirituality, and this is my definition. Everybody will have their own definition, but I like to think of it in the broadest sense possible. And that is, it's connectedness. It's how we express meaning and purpose. It's what feels alive in us. It's our connection to nature. So that's what spirituality means to me. It's not a core. It's metaphysical. I think maybe that's another. Depending if that resonates with folks, it's a metaphysical. It's anything that's outside of our physical bodies, I feel. So having said that, that's like wide open for how people experience it and how people toward the end of life are dealing with it. And so I think as a team, we have to go in and understand where that individual is at, meet them where they're at, and then just, be there, be there to shepherd them through their own process.
That's incredible.
Mm.
That is an incredible way to approach it. And I wonder, from all of your years of experience around in and around, people with terminal illness or with serious illness, and with with the elderly and with people at the doors of transition. If you have seen something like this anywhere, or yeah, like what um is this a need that you saw was an important one to, like, a problem per se to solve, or in terms of, yeah, your experience of the field of across the country in terms of the way people approach these things?
Yeah, let me answer that in two ways. First, I owned a 250 client home health care agency in Florida. And, you know, we sent home health care aides into the home for people who wanted to age in place or into an assisted living facility, for example. And we took care of their activities of daily living, you know, feeding, bathing, uh, transferring. Also, we would go shopping for them, transport them to their medical doctor's appointments. And that's all. That's all we did. And, now I go, oh my gosh, I wish, I knew then what I know now. And I would do two things much differently. First off, I would train the home healthcare aides in mindfulness. And it's not a matter of saying, oh, Mrs. Smith, we're going to do some mindful exercises today. It's your mindset. The healthcare aide comes in, and they're grounded. They can see that the individual may be agitated, and they'll actually say, let's talk for a little bit, and almost become a meditation. We talk about co-regulating breathing. Sai, I don't know if you do this in your work, but you help an individual slow their breath down. When you eat a meal, you're asking them what they are grateful for, not just for their meal, but today, Mrs. Smith, what are you grateful for? So you're embedding mindfulness into the whole process. So again, not necessarily psychedelics, because we can affect a lot of, again, overcoming the fear of the unknown, being grounded, lessening anxiety through a lot of different types of practices. But yeah, what I would absolutely have loved was ketamine. And again, because it's legal, and I could also say psilocybin, but I would love it if a home health care agency company got in touch with me and said, yeah, let's train our health care aides on ketamine. And under the supervision of a prescribing physician, and other medical personnel, and maybe licensed mental health clinicians, the home health care aides could administer. In this case, it would probably be the sublingual lozenges or the intranasal, as you mentioned, Sai, or potentially even rectal administrations, depending on the individual, or topical. So I just think that would be a really great thing to offer people. So yeah, any home healthcare agencies out there, let me know.
Mm, such a beautiful answer. I, I have this story. Jonathan is about to ask a question, but I also, I just wanted to reflect on what you just said, especially regarding the mindfulness, and also just noticing this need, or this gap. It's very tragic, and there's no real blame. It's like there are people who are doing this incredible work of feeding and bathing and caring for these people, and they just aren't trained in some ways. And it's like, it seems like, wow, if we could just add one or two things, then it's like the whole system would just thrive, it could have the potential to thrive more than it is. And it's something, I noticed recently in a facility where I was looking around, and I'm like, this is a memory care facility, and it almost seems like the people working here are like more, it's like overwhelming for them. I could see that it was overwhelming for them. And in some ways it almost seemed like they were the ones with the memory problem. Like it was, because they were so just dissociated from their own work, because I imagine it's so intense to be in a
Mm.
room full of 50 people who are all in, a deep state of need, and they don't have, these are like young people. These people were like in their early 20s probably, and I was it was breaking my heart to see that side of it, and just to think like, gosh, this seems like such a huge project. Like, where would one begin with trying to solve it? And here you are. And so thank you.
Well, it takes a special person to do that work, but that doesn't say that that doesn't carry its own problems. And we talk a lot about that as it relates to psychedelics, because, yeah, if you take that, what you're talking about, which is already stressful and burdensome, and you're working with psychedelics, and now let's talk about people that are closer to the end of life, and you're attached to those people, and you're going to lose them. That's that you're already experiencing that, whether that's in hospice or in a nursing home or memory care. But then you look at what psychedelics can open up in an individual, the spiritual material that might surface, and you're sharing energetics with or without psychedelics, but now you're really sharing energetics with that individual, and you have to maintain your centeredness, your grounding, in order to be there for that individual. And so self-care is important. You may need your own energy healer, to clear the energy, periodically.
I joke that self-care is my full-time job,
Yeah.
and hospice work is my part-time job.
Right. It, a lot of this strand of like your actual experience in the industry, and then and Sai, your experience in hospice. And I think about so much of the gap right now that exists between how so many of us are actually facing and entering death, and the gap between that and one that really is enlivened by psychedelic medicine, and also the psychedelic medicine of, like you're talking about, gratitude and mindfulness, and having spiritual consideration and a broad understanding of what the spirit really is, having all that integrated. That gap for so much of us, I think, is like, I think people don't even know this is something they could ask for. I think so many people probably in their hearts have stigma and would be scared, like, if I'm like in my uh yeah, if I'm like in my 50s, and I'm my parent is now entering end of life, and I'm sort of tasked with helping that out. I might have never heard of psychedelics except for scary stories, or
Right.
like or like I just have no context to get that this is even available. Yeah, and I say that as kind of, I guess, wondering how your work with EOLPC, and just your work in general, like, how do you see that struggle of popularizing this and just getting people to actually know what they're looking at when they look at this stuff?
Yeah, you could look at it one or two ways, and I choose to look at it this way. I do as many free online events as I can that are educational on a wide variety of relevant topics to end of life, as I defined it up front, and psychedelics. So it's been amazing to me that those free online events are very popular. And so we know that there's a need out there. I mean, we know that your users will love this podcast, not because of me, but because this topic is really, really resonating, and people want to talk about death, in meaningful ways. So, you know, I don't sit around and say, well, people aren't getting educated or more people need to be educating. I'm just doing it. And it's growing. It's clearly growing, and beyond that, and potentially even, well, maybe not more critical, but just as critical, is the fact that we need to get these messages and education to palliative care agencies, to hospice agencies, to oncology centers, because there is such a lack of understanding and acceptance. Within a hospice agency, people use ketamine, but they use ketamine for terminal agitation. So when somebody's really close to the end of life, or for acute pain that they haven't been able to deal with. But other than that, they don't use it for existential distress. So it is a matter of saying, all right, let's really talk about this, and let's give you ways to create the pathways to deliver it. And that goes back to when I was talking about this home based ketamine and spiritual care pilot. It's not just to prove out the value of spiritual care, but also, what are those reimbursement models? What are those referring pathways? How can we educate the community and develop those assets in order to deliver this medicine to the people who want them? So that's what I look at. Whatever it is I can do, and certainly it's End-of-Life Psychedelic Care, or EOLPC, is not the only organization doing this. There are other organizations doing this, and together it's mushrooming, and maybe not as fast as we would like, but it's going to come from both, I think, clients or consumers pushing it, or you raised a good point, Jonathan. The adult child of an individual who could potentially benefit from psychedelics, and pushing that upwards and talking to your doctors and bringing it up. And if your doctors don't like it, some doctors are very, very dismissive because they don't understand it. Sometimes you can help them get educated by sharing the research. And if they're just not budging, then there are psychedelic societies all over the country, and anybody can Google their regional psychedelic society, and they will begin to put them in touch with the right people. And of course, anyone is welcome to reach out to me. But there are the pockets of support that people can turn to if their medical care providers or mental health care providers are not.
I have hope or something coming up as I'm listening to you. It feels like the movement is on. It's on the march. There's something really hopeful.
Yeah, who was that person? She was the head of the National Drug. It was one of the agencies with drugs, not DEA, and not FDA. And she said the trains left the station. So even at a federal level, even if they're moving glacially or moving backwards sometimes, there's an understanding that this is coming.
Oh, it's so interesting as I'm feeling into that. There's an appreciation for how much that really changes society as we become more accepting of the psychedelic experience and the unique wisdom and unique abilities and possibilities that it opens up. There's a real, yeah, just as I'm feeling that out there, it's like um yeah, I was speaking with a psychedelic researcher the other day, and there's this sense of, in the 60s when it erupted in the counterculture in the West. There was such a change to that part of culture, and then a lot of those people media. So then it's like kind of in the media. There's like a little bit of more psychedelic understanding and storytelling and stuff. But in the West, it's still pretty not informed yet by psychedelics. And as that changes, it's like I'm excited to think just how.
Yeah, it has me think of like what if we get to decide, which we do, would we want to reclaim as a culture? And it like the first thing that comes to mind is rites of passage. Like, and I think I saw something to this effect on your website, like birth and death and marriage are pretty important parts of a life. And those are it's like, and if we're reclaiming, if we can reclaim and like make those things what we center everything else around, like imagine, well, we are
Mm.
doing that. So we are doing that. We are doing that.
Yeah, because what propelled me to launch the nonprofit was not necessarily psychedelics. It is a tool, a very important tool, and one that I feel can really accelerate this shift in our beliefs around death and dying. So, it's happening in the medical world, again, albeit slowly, where as opposed to looking at death as a failure, a physician wants to do anything possible to keep their patient alive. And that is shifting. Let's talk about what a good death might mean to an individual and talk about it. A lot of times, medical personnel actually don't want to talk about death and dying. So to shift that, and
Mm.
psychedelics can help with that. That's what makes me so excited. But there is this base kind of desire to go, I want to understand death. I want to understand death to my best ability and how I understand it. Again, it's, just like spirituality, death is going to mean something different to different individuals. But if I can come to terms with it, come to peace with it, and psychedelic medicines can help that, yeah, everyone should have that option. Clearly, everyone should have that option. And again, people come to their own understanding of what that is, but just as importantly, then it frees them to understand that, life is precious and I am going to focus on what's important. This is why I love meeting folks like you, Cy, Jonathan, you too, but folks who work with people who are toward the end of life or transition, right? Are in transition, because what's important in life. You strip it down to its essence, and the little things that bother most of us, it's like, come on, that's ridiculous. So you understand what's important in life. And again, this is where psychedelics, I think, can really help with that as well. You come to an understanding of yourself, and you come to an understanding of what your meaning or purpose might be. Although I am reminded of, it was Joseph Campbell, I don't know if I'm going to remember what his quote was, where he said, it's not to find our purpose in life, it's to have the experience of being alive. And I think if we
Yeah.
can bring people that, and psychedelics can help, certainly I know lots of stories where they do, then I think that's exactly what we need to do. That reminds me, I want to share another story if you don't mind. This is a
Love
psilocybin
that.
story. A psilocybin story. So this was a gentleman, Jason. He was on one of the panel discussions I held last fall, and that video is on my website too. So Jason had been living with quadriplegia for 31 years. He had, I think it was a water skiing accident when he was a young man. And for the most part, he lived with his quadriplegia. But it got to a point after all those years where there was excruciating pain that couldn't be resolved with normal pain meds. And he wanted to die. I mean, he clearly wanted to check out. And he was a member of the Sanctuary Church. So that is a psilocybin church based in Kentucky. It's Psiltuary. And they have a program called Sacred Passages. So it's developed a special ministry for end of life. So he participated in their psilocybin journeys. And there's just two things that are so incredible. He met a woman, fell in love, does not want to die. But he tells this story during our panel discussion. He lives in a bubble between life and death, and he sees himself going back and forth. It's really a sort of fine line. And because of his quadriplegia and the effect on the brain, I'm not a medical person, sometimes he checks out and he's not sure if he's coming back. So he lives in this perpetual state of love and gratitude for living. It's like, it was so incredible to listen to him talk. Same with Thomas. I mentioned Thomas Hartle. His first psilocybin journey was to reduce debilitating anxiety, and he did. His second psilocybin journey was to then reduce the debilitating anxiety, because after about 3 months, it started to creep up. But then he began to expand. And this is another thing, for your viewers to know. You might start with an intention like anxiety, but then, it's, I would say it's never one and done unless that's what the person wants. But there's always a potential for multiple psilocybin journeys over time. He began to expand his intention, and that's where he began to realize, it's all consciousness, and really came to terms with living in the present moment. And I always share this story of the tuning fork, where he talked about a bucket of iron filings. What is that? It's just a heavy bucket of iron filings, and you can melt them down and you make a tuning fork. It's still just an object, but when you strike that tuning fork and that vibration goes out into the universe, it goes out into the universe forever. And that's what he came to believe. And when I say believe, embody. And that's what he shared. His legacy is incredible.
Wow.
But
Gosh.
do I have time to share a ketamine story?
Absolutely.
Okay, a ketamine story. So Jason was an example of somebody who wanted to die and then, no, I don't want to die. This particular ketamine story is about a gentleman who already had medical aid in dying approved and was kind of sitting on his shelf. He'd had it there for 3 months. Again, he was to a point where the pain was so excruciating, it was a 9 to 10, no matter what meds he was given. And this is another beautiful thing about ketamine. It helps the pain while reducing the need for opioids. So he had ketamine administered by a palliative medicine physician in the home, and his initial intention was to release trauma. And he had inflicted trauma, so he had a lot of shame, held a lot of shame. And that first ketamine journey was just thrashing and screaming and yelling, and he was just obviously very visibly upset. Ketamine lasts 45 to 60 minutes, so I guess luckily in a way that it didn't go on for a very, very long time. And when he came back out of his journey, he calmly retold what he lived through, which he lived through his trauma that he inflicted, much more calm. His pain level was 0. And his pain level the next day was a 2 to 3 as opposed to a 9 to 10. And he still felt very calm. I can't say that after one ketamine journey he had relieved all the trauma, but he felt a lot calmer from that. So then the second ketamine journey, he had 3 ultimately. The second ketamine journey, he said, I want to gain clarity on the use of medical aid in dying. And he did. He said, yeah, this is what I want to do. So then some time had passed until the third ketamine session. And in this case, he asked again for clarity, and his intention was to resolve the relationship with his son and bring closure to that relationship. And he did both. And then, I don't know, I
Mm.
think within about a month, he then took the medical aid in dying. So, an example of somebody who used psychedelics to say, yes, this is right for me. And I think everyone should have that agency. And Jason is an example of someone that said, I'm good. Not to say down the road he might come back to it, but right now, I'm good. So I love all those stories because they really show the potential for what psychedelics can do.
Yeah, especially with the somatic release and of the trauma, and then that being directly tied to a pain reduction. At least my story, I imagine that pain was the trauma itself, and that's another thing, in terms of this education. And Gabor Mate does a good job. There's lots of people out there doing a really good job talking about trauma living in the body, and that is, that there are wounds there and pain there and disease there, and then that, he was able to somatically release that and then experience a complete shift in his pain level is just incredible.
Mm.
Yeah, we
Oh,
know. I
Mm.
don't. There's probably studies. If there are, I'm not. I don't know them off the top of my head. But that reducing spiritual distress reduces pain. Chaplains know this. Yeah.
yeah.
I'd like to mention the Death Sangha, if that's all right with you.
Yes.
Yeah, the Death Sangha.
Yes, yes. Yeah, it feels before you told the beautiful stories you just told, I was thinking this would be a good time to talk about the Death Sangha around, community um and rites of passage and building a culture. Yeah, so
Hmm.
yes.
Yeah. Thank
We would
thank
love to
you.
hear about it.
It's exactly that, building the culture. And there's several opportunities in order to do that, to talk about what does death and dying mean to me, to come to terms with it, to prepare for death and dying, to decide what your legacy is. So there's death cafes, there's death over dinner, among other programs. But what I haven't seen, and what my friends, these lovely, I call them modern mystics, modern day mystics. They're just incredible. They really understand why it's important and how individuals can really come to terms with understanding their death and dying. So, this is basically what I talked about up front. It's individual, but if you can understand death and embrace it, that is very, very liberating. So, we are talking about launching the Death Sangha, which is a contemplative community. So, this is how it is different than the ones, that are at least nation or worldwide that have online forums. So, a contemplative community that will be semi-structured, where we intend to have weekly online calls, facilitated by one of the modern day mystics. And we'll begin to really explore what it means. And then our plan also is to host our first in-person get together in California, and it will be ketamine, since ketamine is legal in the state of California. And it will be a retreat where there'll be workshops and intensives and individual work on, let's talk about death. Let's build some practices. And it is a practice. I'll come back to that in a second. But yeah, that's what we want to do, is have this retreat. We're looking at October. But when I say practice, I don't want people to think, oh yes, I'm going to participate in a psilocybin journey, and I'm good with death. I've experienced everything I wanted to. Now maybe that's the case. But I have a friend here in Ashland who is using psilocybin to experience death. So she wants to get as close to death or experience death, in the now, through psilocybin. But again, that's a practice. That's not something that you say, oh yeah, I want to do this tomorrow. Can we get together? It's, her meditative practices, it's her other spiritual practices, it's how she conducts her life. That now she's looking at psilocybin and she's very experienced in psilocybin. Let me open up to what death might look like. So I absolutely love that. And that's what we hope to bring to people.
Just as you're describing that, I had this idea a few weeks ago, and I told Jonathan about it. But Jonathan and I are trained in a practice called circling, also known as transformational connection in some areas of the world. But it's a practice of deep presence and mindfulness and meditation. And we've done a ton of training over the last few years in this. So my idea was to start a closed container, probably online at first, but hopefully in person here in Charlottesville, called Circling Death. So very similar to the Sangha, but where, there's maybe 8 topics that are related to death and dying, but rather than just sitting and talking about it, we're actually going into the sensation, the emotion, the thought forms, the things that are arising in the present moment as we're exploring that topic. So it sounds just so similar to what you're in many ways to what you're describing. And it just has me excited that there's this sort of parallel evolution occurring across. I'm already all the way here in Virginia and you're all the way over there. And yeah.
And there's others across the country. And I absolutely love, in person to me is best. But not every community, very few communities, have this wisdom, and desire to bring this to their community. So online, I think is a good second.
I'm wondering if you could send people maybe with what's a good link, what's a good way to find your work and support it if they're interested or yeah.
So my website is EOLPC, stands for End-of-Life Psychedelic Care. So EOLPC.org. You can reach out to us there through the contact form, or you can reach me directly at Christine, which is CHRISTINE, at EOLPC.org. We have many of our videos on our YouTube channel, and we offer an online support group for an individual who has been diagnosed with a serious or life-threatening illness. So it's a really nice forum for individuals to get together and share their concerns and learn from each other and gain support from each other. Then we have a directory where the practitioner in the directory has to be experienced in both end-of-life and psychedelic care. And we offer then professional courses as well. But we offer a lot of free online events, and so I try to post those as often as I can.
Awesome. Well, Christine Caldwell, thank you for hopping into the container. And with that,
the container is now closed.